Dr. Jennifer Sosnowski. I wanted to talk with you today about MeRT. It's a promising neurotherapy for those with PTSD, TBI, anxiety, depression, and insomnia. Wanted to share this fabulous new therapy with you because we have found it to be just awesome in our clinic, and we wanted to introduce it to you so that you could know how fabulous it is, and maybe it would be helpful for you or someone in your family. So what we'll discuss today is what MeRT is, the MeRT process, why MeRT achieves better outcomes, how MeRT can offer new hope to those with PTSD, TBI, anxiety, depression, and insomnia, and what your QEEG can reveal about your brain health. We're also going to talk about the differences in effectiveness of MeRT as compared to rTMS, which is the grandfather where MeRT came from initially. So initially, I wanted to start with a quick testimonial. This is a client of ours, Catherine H. She's a MVP medical care patient, and she used to live her life with a constant fear and being unable to cope with stress. And she was feeling absolutely overwhelming dread all along the day and physical anxiety symptoms. She now wakes up every single day with energy and a sense of peace and calm like she's never felt in her life. She's no longer having nightmares. She can sleep easily through the night. She doesn't have cravings for alcohol. And she feels that this is truly the version of her that she always knew she was capable of being, but just couldn't get out of the brain fog of her anxiety and depression. And she feels after MeRT therapy that she's now motivated to live her life to the absolute fullest. This is awesome. Absolute fabulous story of a woman getting her life back again. Now, this is her questionnaires that she answered for us regarding her memory and brain fog scale and anxiety scale. Initially, she was way off the scale up here, over 20 on her depression, on her anxiety and her memory and brain fog scale. And over the course of 2 weeks, she went down to a 5 on anxiety and a 4 on memory and brain fog, and then a 3 on memory and brain fog and a 2 on anxiety. And then she stayed right there at 2 at week 6 for anxiety and memory and brain fog. And then anxiety went down to completely nothing at the end of 8 weeks. Absolutely fabulous response. And I'm sure any of you out there with anxiety would love to be able to say that it's completely gone away. Jody is another client of ours with PTSD. And she said the MeRT therapy had absolutely transformed her life. She came from a dynamic past of trauma and addiction, and she had no idea how that imprint on her brain had affected her life. She used to live in a life of fear, waiting for something bad to happen. Now she feels that she's living in a sense of safety. She had no idea that life could be experienced without the daily effects of PTSD. Her energy is better, her sleep is deeper, her anxiety is gone, and she's so thankful that she found MeRT and decided to go forward with it. So her questionnaires, we did a PTSD questionnaires for her. She started at almost a 50 on the PTSD scale, and after 8 weeks, she was down at an 8. Absolutely tremendous progress. So how does this all work? Well, MeRT is neuromodulation. Neuromodulation is a technology that acts directly upon nerves to alter or modulate their nerve activity by delivering electrical or pharmaceutical agents directly to the target area. It involves electrical stimulation to the head via a magnet, and it improves the performance of groups of neurons in the brain. This helps the brain process at the same speed and coherently from back to front, allowing for improved brain function. Now, the brain has limited ways to respond to trauma. Now, traumas to the brain can be actual trauma, like a head trauma, a severe emotional event, chronic stress, impaired sleep, chemotherapy, alcohol or drug abuse, you name it. The brain stress then slows down or speeds up nerve groups, which leads to brain fog, anxiety, emotionality, such as anger and fear, insomnia, and many other symptoms that really can impair people's lives. So if you're suffering from difficulty getting to sleep, lack of interest in hobbies, hopelessness, avoiding memories of trauma, inability to stay asleep, feeling on edge all the time, an increased irritability or anger, fatigue, inability to focus, difficulty falling asleep at the beginning. Now, whether it's you or a loved one, these are people that those that have these symptoms are people that could really benefit from MeRT therapy. Now, MeRT can directly restore healthy brainwave activity, which can then improve headaches, brain fog, mood, anxiety, insomnia, attention, dizziness, memory, irritability, reaction time, fatigue, photosensitivity. Now, photosensitivity is more something we see particularly related to TBI, but we also have some photosensitivity and particularly related to PTSD as well. So common symptoms of anxiety, PTSD, and TBI are not only physical, but they're also emotional and lead to behavioral difficulties as well. So anxiety symptoms, and one of the reasons I bring this up is because many people that have problems with anxiety, PTSD, or TBI don't realize that they have these symptoms. As a matter of fact, the majority of those folks that came to us to do MeRT that had anxiety didn't realize how bad their anxiety was until it was actually gone away. So symptoms of anxiety that we see are heart pounding, sweating, restlessness, some shortness of breath. Sometimes physically they have worry, irritability, mind racing, fatigue, and they, in their lives, it corresponds to avoidance of certain activities, obsessive compulsiveness about what they're doing, or social distress when they're in social situations. For PTSD, we see symptoms of having flashbacks, nightmares, emotionality. We see people avoiding different things that can stimulate them, having negative thoughts, being hopeless, being numb or feeling numb in their lives, having difficulty feeling any emotion, and having difficulty in relationships. In their physical symptoms, this can lead to startle reflexes, insomnia, and concentration difficulties. Now, TBI symptoms are somewhat different in terms of we often see TBI after loss of consciousness. It can cause some headaches long-term, insomnia long-term, fatigue long-term, sensitivity to light or sound, and dizziness. Emotional symptoms we see are mood swings, irritability, depression, memory issues, and difficulty with focus and concentration. And all of these can lead to changes in terms of their behavior as well, because there may be avoidance of social situations because they don't feel good. Some of my patients that have had TBI issues will avoid going to big stores because there's just too much activity. It makes them busy. There can be a variety of symptoms that people feel that they didn't know was related to this. So do any of these symptoms sound like you or someone you know? The conventional approach for TBI is meds and physical therapy. For anxiety, depression, medications, talk therapy, and PTSD, antidepressants, sleep medication, talk therapy, or EMDR. Treatments may be lifelong as they're not all that effective, efficient, nor do they resolve the root cause of the illness. Quality of life suffers in this case. So the functional and integrative approach for TBI is treatment with supplements, healing of leaky gut issues, reduction of inflammation in the brain. For anxiety, it's determining the true underlying cause, whether there's an infection going on, and treatment of that, improving the diet, healing the gut inflammation that goes along with this. And for PTSD, it's treatment with supplementation, reducing inflammation, turning down stress response, and improving the mood. And this can also involve some talk therapy for these as well. But we also find that there's a lot more to it than here's a medication and here's a doctor, psychiatrist to go talk to. With our approach using MeRT, we can see evidence of brain injury or trauma using our QEEG, and then treat your brain in a personalized and very specific approach using direct nerve stimulation or MeRT without any drugs. Now, conventional therapy lacks even the proper means to diagnose a TBI, as these may be missed on CT scans. So often they'll tell you your brain is fine when actually you don't, it's not, and you have some significant symptoms, residual. So what's the steps for MeRT? First of all, meet your technician, Carissa. Our office manager, Julie, may also work with you, as well as Alex, who's our new MeRT technician that just started with us. The first step to therapy is an EEG to evaluate where the brain is functioning well and where it needs improvement. This is the EEG cap that we wear to get that EEG. The next step is an EEG. That EEG is produced into a NeuroRef, which includes a QEEG magnitude spectra, which shows how strong the different waves are in terms of their power, as well as a QEEG relative power map, which will then show where the most power and energy of the brain is focused in the frontal lobes. This is used to create a personalized treatment protocol using magnetic energy given to the brain. So the last step is the therapy itself. The MeRT therapy is 5 days a week, Monday through Friday, for 30 minutes for a 2-week trial session. It's preceded by that EEG and a consultation with me. And at the end of that 2-week session, there's another EEG and a 15-minute meeting with me. The QEEGs are repeated every 2 weeks to assess how treatment is going, to make sure that we're seeing the progress that we expect. And if not, we change how therapy is given. If the therapy helps after 2 weeks, we suggest a total of 6 to 8 weeks to ensure lasting change in the brain. So whatever treatment or whatever benefits you've received, these will not necessarily become permanent after just 2 weeks. About 6 to 8 weeks are needed to see those becoming permanent. And this is a client of ours getting MeRT therapy in the chair right now. So the QEEG and the NeuroRef reveals a lot about brain health. We have 4 different kinds of waves that we're looking at on the QEEG. We have the 1 to 4 hertz waves in the red over here, and these are the deep sleep waves. Now, nobody is in deep sleep during the MeRT, so you're not going to see anything there. We have theta waves at 4 to 8 hertz, and these are your light sleep waves. These are literally the waves that you go into when you're falling asleep. But they can also be seen if somebody has had a prior TBI, if they've had PTSD, or they have sleep apnea, chemo brain, many different things. And these theta waves, because they're going slower than the alpha waves, can cause a lot of anxiety and brain fog. Alpha waves are our main thought processing waves. These are the 18 to 13 hertz waves, and these are relaxed concentration or focus waves. The 13 hertz folks are the elite military and the elite athletes. These are the guys that really need to get the split-second decision making to keep their lives safe. You see 9 to 10 hertz waves in more of the musicians or the artists. These are the folks that see the world in broader colors than actually in fast action. So they both have their skills. We also have the beta waves, which are 13 to 25 hertz. These are waves that, when they're little, can lead to motivation and drive, but can also be responsible for a tremendous amount of anxiety when they're big, honking things over here, or particularly when they're taller than the alpha waves. So these are the 4 types of waves we're looking at in our EEG. So this is the QEEG magnitude spectra of a 53-year-old mom of a child with autism. So you see here some very strong alpha peaks at about 10 hertz. You also see when you're looking at these alpha waves, all alpha waves start in the posterior part of the brain and then go to the anterior, the frontal lobes. So you want to see that these waves look very similar from back to front. And this is a fairly narrow base to that wave, and that's definitely good too, because the brain thought is more organized, and the coherency is that it looks the same from back to front. We're also seeing here a small beta peak at about 19.5 hertz. This is that motivation and drive. And you see down here in the posterior that goes all the way up, a small theta peak at about 5.5 hertz. This is fabulous because it's tiny, and otherwise there's no active theta in here. This is the QEEG magnitude spectra for a 52-year-old female with a TBI. And here you see at 11.5 hertz, this green arrow, a alpha peak that looks very good. You still see it going forward, so it is coherent. It gets a little wider at the base here. But you also see a very evident theta peak in this yellow range sorry, let me go back one. That is quite high in the posterior, and as we get the central and the frontal lobes, is actually higher than the alpha wave. Now, this is somebody whose brain is going to have a lot of issues in coherent thought, because this person's brain wants to be in light sleep all the time. And that theta is actually being much stronger than the alpha is going to lead to significant issues in memory, in focus, in word finding, etc. There's also a teeny tiny beta peak here at about 21 hertz, which is fairly insignificant. This is the QEEG of a 30-year-old female with anxiety. And you can see in the green down here, a very diffuse alpha peak, because it's very wide based, but it's about 11 hertz, so it's nice and got a decent speed to it. You can see that it is coherent. It does go up to the frontal lobes. There's also a theta peak at about 7 hertz. This theta peak, just like the prior EEG, is much higher than the alpha peak. So again, a very unstable brain. Here you see a significant elevation of beta, because if baseline is down here at this line, there's elevation of both theta and beta, even in the posterior part of the brain. But as you get to the central brain, there's a significant elevation of beta here. I'll do that. And there is a significant elevation of theta here. And again, you see that theta in the frontal lobes even higher than that alpha there. So this is definitely somebody that's going to have significant problems with anxiety and maybe collecting their thoughts a lot of times. So I wanted to show a EEG progression of a 38-year-old woman with PTSD and depression. This is over 4 weeks of time. She had her EEG, initial EEG that showed a alpha wave right here at about 11.5 hertz, which is great. As you see going forward, the alpha wave seems to be a little bit slower than actually 11 hertz in the central and the frontal areas. After the weeks of MeRT therapy, you can see much higher alpha waves, so a much stronger, more resilient brain. And that alpha wave actually is much stronger all the way forward. And you can see that this alpha wave is now higher than the theta and higher than the beta. So definitely more resilient. You do see, still see some theta here, although it is lower than it was in the beginning. But if baseline's down here, definitely some elevation still. And often we see that even though symptoms of anxiety go away very quickly. In terms of the beta, you see a small peak of beta here in both the central and the frontal leads. So amazing success over the course of 6 weeks. So who can MeRT help? MeRT offers a personalized, non-invasive, non-pharmaceutical approach for several very common medical complaints. And most importantly, symptoms resolution starts in 2 to 3 days. So MeRT is FDA cleared for depression resistant to multiple drug use, so at least 3 drugs, for obsessive compulsive disorder, for migraine with aura. But we're also having fabulous success with a number of other conditions, including traumatic brain injury or post-concussion syndrome, PTSD, post-traumatic stress syndrome, autism. Kids can actually start talking. It's truly amazing. Anxiety, tinnitus, insomnia, brain fog, cognitive impairments, chemo brain, addiction. Now, many of the folks that initially started using MeRT were PTSD and TBI veterans from the military. And many of those, as you've probably heard, are using drugs and alcohol to calm their symptoms. And as their anxiety calmed down, by the 3rd week, many of them were able to reduce or get off of all of their drugs completely. Absolutely amazing success. And amazingly enough, they had absolutely no withdrawal symptoms. It's fabulous for sports optimization or brain optimization for all of the rest of us. Some people are ineligible for MeRT if they have any of the following. If they have a pacemaker, a nerve stimulator, a defibrillator, intracranial metal, for instance, a coil in a artery that was a little enlarged, a steel shunt or a stent or a filter in the brain. Absolutely ineligible because the MeRT is done with magnetic therapy like an MRI. So if you'd be ineligible for doing an MRI, you'd be ineligible for MeRT as well. We all have special circumstances that allow us to continue to do therapy with seizure disorders, bipolar disorder, titanium metal implants in the head or in the teeth, or hearing aids, which is fabulous. So how effective is MeRT? Well, this personalized treatment protocol produces much safer and more profound results. It's twice as effective as standard TMS, which is transcranial magnetic stimulation, which has been around about 30 years. But TMS treats only depression and OCD, and we're seeing much better success with MeRT for many more treatments. This is a testimonial from Roman. He's an MVP client that came in for problems with anxiety and insomnia from a lot of work stress in general. He's a businessman that owns several businesses. And at the start, his anxiety score was an 11 and his depression score was a 7. And after 4 weeks of therapy, his anxiety score was down to 4 and his depression was down to 2. And after 2 more weeks, his anxiety was down to 3 and his depression is down to 2. That's absolutely amazing results over the course of 6 weeks. We have also found, and the Belfer Institute with the Harvard Kennedy School has recommended that MeRT be the sole meaningful intervention for traumatic brain injury because it is so useful for TBI in getting people's lives back. So some of the data in PTSD, the 30-day outpatient treatment with which is 4 weeks of treatment with MeRT, resolved symptoms by 32.5 points as compared to 30-day inpatient residential treatment, which resolved symptoms by 10.8 points, as compared to neurobiofeedback, which resolved symptoms by 4.9 points. So you can see absolutely impressive changes as compared to the other available treatments out there. Now, MeRT has also been looked at in terms of many of the different symptoms as compared to other therapies. And if we look at depression, there's a 78% improvement from depression symptoms as with MeRT as compared to the status quo, which is typically medications and talk therapy. For sleep, the sleep symptoms resolved 68% as compared to medication, Ambien or Zolpidem, which resolved symptoms by only 21%. Anxiety symptoms were reduced by 67% as compared to 33% with cognitive behavioral therapy and drugs. And TBI concussion symptoms were resolved by 57% as compared to TMS, which was that other therapy, that transcranial magnetic therapy we just talked about. And then PTSD symptoms, there was a 49% reduction in symptoms with MeRT as compared to TMS, which reduced symptoms by about 12%. So absolutely, there's no comparison to any other therapy out there in what the MeRT can do to help you get your brain back to normal if you're having symptoms. So the benefits of MeRT are, first of all, resolving the issue at the source, working on the brain directly. It's an innovative technology that shows promising results for off-label indications and for many, many indications. It's non-pharmaceutical, non-invasive, and there's minimal side effects or adverse events. And it's in an outpatient setting. It restores natural brainwave activity. It's a fraction of the cost of medical management and support services by resolving symptoms. So the lifetime medical management and support system services that are needed cost so much money over time. But if you can resolve the symptoms completely, you're not going to need that anymore. It's difficult to quantify the impact for patients and their families. Absolutely transformative quality of life changes. Anybody that's known anybody that has addiction or PTSD or severe anxiety knows that their quality of life is horrible, and that impacts not only the patient, but their families. Their clinical efficacy is corroborated by post-treatment brain imaging. We do that EEG all over again. And with these questionnaires, we can actually show how much better their symptoms have gotten over the course of treatment. So frequently asked questions that we get, is MeRT covered by insurance? Unfortunately, it's not for many conditions. However, we have been able to get it covered by autism. It is covered for migraine with aura. It's covered for depression resistant to medications, and it's covered for obsessive compulsive disorder. The treatment is typically 6 to 8 weeks recommended if you're getting success. It's 30 minutes a day, 5 days a week, Monday through Friday. The results, if you get to 6 to 8 weeks, are permanent. They do not go backwards unless there's more episodes that happen. If there's another inciting PTSD event, if you're having some cognitive impairment and you're continuing to behave in such a way that you increase the inflammation in the brain, then the results may not be as permanent as you'd like it to be. Is this the same as neurofeedback? Absolutely not. And what are the side effects? Well, really, we see very few side effects, if any. If we get some overstimulation, we may see some problems with sleep or with irritability. And we are constantly asking about that when clients come into treatment every day. So we try to make sure that that does not happen. Now, what does it cost? Well, if you are watching this webinar and you'd like to come in for an initial EEG, it's actually $595 for the EEG and a consultation with me afterwards to go over that QEEG and talk about what it shows. From there, if you decide to go forward with a 2-week trial, the 2-week trial is $29.95. And if you paid for the QEEG up front, then that price is deducted from the total of $29.95 for the first 2 weeks of therapy. If you decide to go onward from there, it's traditionally about $19.95 per week going forward. Although we typically suggest at least 4 more weeks for a total of 6. So we do have a 4-week package as well. So if you're interested, please give us a call at MVP Medical Care. We'd love to get your EEG scheduled and figure out how your brain is working.